Skin Health Canada, which represent Environ here in Canada, decided to conduct what they call the Ingredients Challenge with the doctor who came to the booth. And actually, this challenge was a visual test. There were 4 unidentified products, and they had the list of the active ingredients that were in the products. And doctors were asked to choose the best anti-aging skincare based solely on the list that was available to them. And maybe not strangely enough, but 100% of doctors choose Environ AVST5 as the product containing the most active anti-aging ingredients. So I think that's a very good introduction to illustrate the quality of the Environ skincare. So why do you think, my first question to you, why do you think that ingredients are so important when choosing an anti-aging skincare product?
Well, basically, I believe that if you haven't got vitamin A and antioxidants in your product, you're not talking about anti-aging at all. So many people make the mistake of thinking that if they have glycolic acid or something like that, that is anti-aging. Mm-hmm. But the truth of the matter is that you have to have vitamin A, and you have to have it in effective doses.
Dosage, yeah. What about the delivery system? Is it as important as the active ingredient? Someone could argue that maybe other line of products have the same kind of active ingredients. Why Environ is better or one of the most active in the market?
Well, we've got 20 years experience of trying to make creams penetrate very well. So there's a very important lesson to be learnt about how to formulate a cream so that it penetrates better than another. Mm-hmm. We know that there's research work showing if you use certain bases for your creams, you don't get as good a penetration as when you use another base. And we've specifically targeted to make products that penetrate into the skin as well as it can.
We could definitely say that nowadays, the patients are more savvy in choosing skincare. There's more information out there, so people tend to choose more carefully the product. So in this quest for the holy grail of anti-aging, what do you think really causes aging? What are the main factors in the aging?
I believe that people are looking for the latest little rave on the internet or in the magazines. They are generally uninformed.
Yeah, there's more information, but they don't know what to do with that.
There's more information, but it's not always accurate information, and that is where I think we suffer a great deal from the internet. When I look at aging, we have to recognize that free radicals are probably one of the greatest causes of aging. Mm-hmm. So we have to do something about that. Another thing that we have to do is to make sure that the telomeres of our chromosomes stay nice and long. And the way to do that is to use vitamin A and to use antioxidants. Both of them have been shown in research work to prolong the length of the telomere. Those are the 2 main competing theories about aging. We can do something about that with vitamin A and antioxidants.
At what age do you think we should encourage our patient to start anti-aging creams, for example?
Well, I believe in the anti-aging for kids.
For kids, absolutely.
Yes.
Tell us about that.
Because I believe that we should really start treating photo damage when it very first happens. If you really want to slow it down, you must start then. Generally, most people think, oh, well, maybe about when you're 18, but I think you're about 14 years too late.
Too late. So
I think you should have started around about the age of 4. When people are getting serious exposure to the sunlight, we know that generally by the age of 18, something like 75% of the photo damage has already been done.
In the quest for the perfect skincare, you mentioned vitamin A, you mentioned a little bit vitamin C, antioxidant. What other products should be part of a good anti-aging skincare regimen?
Well, I think since we're trying to build up the amount of collagen, we should use peptides. You see, and we shouldn't fall prey to the common misconception that there is one antioxidant that is all-powerful. There is no superior antioxidants. We know that there's certain basic antioxidants that we have in our skin, and vitamin C, vitamin E, these are important basics, alpha-lipoic acid, coenzyme Q10, and then the one that we can't use, which is glutathione, which only gets manufactured in the skin. But what we need is the broadest spectrum of antioxidants that we can manage for both the lipid phase and the water phase. The people who promote just one, say, pomegranate, which was quite popular, you know, that only does one little bit. We need to cover all aspects of free radical damage. So that's why I am very adamant that people should not rely on just one antioxidant, but have a spectrum of antioxidants.
Most of your lines in the Environment product, it's a step-up program. So why is it important to follow the steps, let's say for the line AVST, for example?
Yes, well, here we've got to understand the metabolism of vitamin A. And the vitamin A can get into the cell through little receptors, and then can get into the nucleus where it works through these receptors. Unfortunately, the receptors are damaged by sunlight, and progressively as we get older we've got lots of accumulated loss of receptors. So when we are about 20, we probably have about 10 to 15% of the receptors that we had when we were young. What we have to do is to stimulate the formation of those receptors so that we can take in the vitamin A. Now the paradox is that vitamin A is the stimulus to make receptors.
Okay.
So you have to introduce the vitamin A slowly so that the body doesn't feel that, oh, I've got too much vitamin A trying to get into the cells.
A retinoic reaction.
That's the reason why we get these retinoid reactions.
Okay.
So that's why I devised this step-up system so that we gradually introduce the vitamin A. And I'm quite strict with some people. I even tell them, you may not use this cream every day. You may only start with it once every second day, and then gradually introduce it. And after a while, they take the vitamin A, and it's not that we're building them up to artificial levels. We're just trying to get them back to the optimal levels that their skin cells would prefer to have.
This is why maybe a patient don't see immediate, let's say we start someone on AVST1 or 2, they don't see immediate reaction because they're building up their receptor. Before really having an anti-aging effect.
That's
you need
right.
to build up those receptors. Okay.
Yes.
Excellent. You mentioned the biopeptides. It's, I know these products are everywhere you find them. I know they've been around for a few years now, and there's more and more biopeptides available, and I think they're very good products, and all the major cosmetic companies have been using peptides, but with maybe very low quantities. But what are the most important biopeptides, and what are the action of these peptides?
Well, I think that the peptide that has sort of set the gold standard is a peptide made in France. Here in America you have two forms of matrixyl. You have the one registered for America, which is plain matrixyl, and matrixyl has been largely supplanted by the new matrixyl 3000. The matrixyl, the old matrixyl had one peptide, whereas the new matrixyl has two peptides. I think that the research work done, initially they showed very clearly that you could get the same result by using matrixyl as you could by using retinoic acid, 0.25. milligrams percent. This is quite a strong boost to the formation of collagen.
For someone who's been using only skincare, what kind of result could you expect? Just only skincare. And what's the time frame? How long would it take to see results?
You know, this is where, like, I'm puzzled by some of my patients. They come along after 2 weeks and they say, my husband says I'm looking better already. I look at them and I think, well, he's very observant because I don't notice. The only one thing for certain is that if it works within a few hours or days, then all it's doing is swelling up the skin. So we've got to be very cautious about that. In general, I think that we see changes by about 3 months, and then they become more established by 6 months. By 18 months, we've achieved a result.
To summarize a little bit this quest for perfect skin, definitely very important to get the right ingredients in the right amount, in the good vehicle in order to penetrate the skin. So basically vitamin A, vitamin C, or some antioxidant put together, and a good biopeptide. So yes, this is the formula for success.
Yes.
Okay, excellent.